My name is Mike Pishvaian. I'm an associate professor in the Department of Oncology at Johns Hopkins University School of Medicine. So pancreatic cancer is a very difficult to treat cancer, but we're learning more about the genetic mutations that occur in pancreatic cancer. And one of the most exciting group of mutations that we see that occur in about 17 to 25% of pancreatic cancers are mutations in the DNA damage response or DDR response pathway. Within that DDR larger subgroup, there's the homologous recombination DNA pathway, and that's most classically defined as BRCA1 and BRCA2 mutations, but there's actually a number of genes in that pathway that can be similarly mutated. And the question is, first of all, do these mutations in the DDR genes or in the homologous recombination genes, do they confer any prognostic benefit? Second of all, do they confer any predictive benefit to different therapies? So the first question has been very difficult to answer because as I'll talk about in a second, they definitely confer a predictive benefit to platinum-based therapy. And many of the pancreatic cancer patients will receive platinum-based therapy. And so it sort of muddies the water in terms of the pure prognostic impact of these mutations. We actually had the opportunity to look at this, and we think that in a retrospective registry study, we think that we were able to answer that question because we looked at over 1,000 patients with pancreatic cancer, and we were able to track these patients over time. And we know that gem/nab-paclitaxel, which is not platinum-based therapy, and modified FOLFIRINOX, which is platinum-based therapy, are two perfectly appropriate regimens to use for pancreatic cancer. And we know that patients that start with one of these two regimens, unfortunately, many of them don't go on to get second-line therapy. So we were able to look at just the patients who received gem/nab-paclitaxel and never received any platinum-based therapy during the course of their lifetime versus a patient who received platinum at any time during their pancreatic cancer lifetime. And what we were able to show was that, first of all, if the patients never received a platinum-based therapy, there was actually no prognostic difference. There was no difference in outcomes for patients who had a DDR gene mutation in their tumor or in the germline setting. So really, it doesn't seem to confer any prognostic benefit. However, for the patients who did receive platinum-based therapy, there was a clear and actually fairly dramatic predictive benefit. So patients who had a tumor-based or a germline-based DNA damage response from repair pathway mutation who received platinum-based therapy, they actually had a 1-year survival benefit. They lived 1 year longer than patients who did not have a DDR mutation, and similarly for patients who had a DDR mutation but did not receive platinum-based therapy. So clear predictive benefit for receiving platinum-based therapy in the DDR mutated subgroup of patients with pancreatic cancer. PARP inhibitors are newer drugs, but they hit sort of the same pathways as platinum-based therapies. They don't work exactly the same, but we think that the DDR mutated tumors are similarly, not exactly, but similarly responsive to platinums and PARP inhibitors. And it does appear that PARP inhibitors also will confer, the DDR mutations also will confer a predictive benefit to PARP inhibitors for patients with pancreatic cancer. Now, we know that for sure in the BRCA1 and BRCA2 and probably the PALB2 mutated tumors. But there are a slew of other mutations that can occur in the DDR pathway, the most common one of which is ATM, but several other genetic mutations that can occur in this pathway. And unfortunately, we technically don't yet know whether a PARP inhibitor should be used in an ATM or a BAP1 or any other mutation in the DDR pathway patient. And these are studies that are ongoing and really need to be answered. And there are other DDR pathway inhibitors that might be more appropriate for specific genetic mutations. So these very fine details are going to be teased out over time as studies target these mutations very appropriately.